I'm Grant Garcia, one of the knee and shoulder specialists here. So today we're going to show an interesting patient with an interesting issue. So in my practice, I see a lot of kneecap issues, cartilage issues, and trochlear issues. But there's certain patients when they get to be different age levels. This patient in their early 50s come in and they're not a candidate for those procedures, but they're also not a candidate for a full knee replacement. The problem is that it's a much less common knee replacement option, which is called a patellofemoral replacement, where we just replace the kneecap and the groove. There's more and more data showing the good success of this procedure, and I happen to see a fair number of these because of the niche practice that I have. This patient was an excellent candidate. They had failed all the different things, therapy, injections. We're told they were too young for a regular knee replacement, and we see really good results if done in the appropriate patients. So hopefully you enjoy the video testimonial and learn more about this procedure. As we see more and more females and more patients coming in for second and third opinions, not knowing about this option, and in the right patient population, you can see results similar to this. Thanks.
So I saw a doctor about my knee after I had been hiking and it was in a lot of pain and swollen, and this doctor told me there really wasn't anything I could do. He sent me to PT. That wasn't really working. I went and saw a physiatrist and I had a cortisol shot. That didn't work. I tried everything, and then I came, my physiatrist actually referred me to Dr. Garcia. I came here. I learned a little bit about cartilage grafting and thought, my physiatrist thought maybe I'd be a candidate for that. And when I got here, I was not a candidate for that, but I did have the partial knee replacement. So the symptoms I had were just the crunching of my knees. There were a couple of times I just stepped kind of sideways, like on something in the grass, and my knee would just swell up. One time I walked to a football game, and I couldn't get up in the middle of the night to go to the bathroom because my knee was so swollen, and I just knew that wasn't normal. And so I knew that I had to do something more. My recovery was great after I got in front of the pain. Initially, the pain catheter didn't work, but I worked with the doctors to get everything under control. Once that was under control, I was totally fine. From day 2 on, I literally took care of myself. It was during COVID. People that were going to help me out got COVID and couldn't come over, so I was walking, icing myself, going up 3 or 4 stairs, able to get in and out of bed. And then I would say after the first couple of months, or maybe it was 1 month, I can't remember, when I was able to do the full rotation on the bike. So initially I was on the bike and I would just rotate back and forth without doing a full rotation. And then one day it just happened. And then from then on, it's going great. I'm at a point now where I've made so much progress, they cut me off from PT. So now I have no pain in my knee. My rotation and flexion rotation, the bending part. Yeah, rotation and flexion are not exactly the same as my other knee, but I don't have any pain. I wish I had done this a long time ago, and I didn't know it was an option for me until now. And so I'm just ready to go hiking, do anything that I wanted to do before, and probably have to have the other knee done at some point.
Would you recommend this to somebody else if they had the same problem?
Oh yeah, I would recommend this. I would highly recommend it to anyone. I mean, the only downside for me was the initial pain. That was the worst part for me. And once I got past that, I was fine.